Started coming to see her about 1.5 years ago. So I had been, at that point, in pain for 3.5 years almost.
Wow.
3 years. Probably about 3 years. Had surgery. I had my xiphoid process removed. That helped, but didn't solve it. So started working with her regularly and also doing hypnosis. And eventually was able to come off the painkillers. And after being on, and I was on, you name it, I had been on it at some point. Been off of all of that since this summer, and have been, I'm back to full, like, it's as if it never happened, basically, at this point, with the exception of, I have all this awesome experience that I've gained, but, yeah, no pain.
So how many times did you start, like, coming here, or how often did you come?
Depending on what was going on, it was really anywhere from, I probably was here like about once a week, sometimes twice.
Mm-hmm.
And then when I was coming off the painkillers and going through a really serious withdrawal, I think I sometimes came even a third time, just because everything was really out of whack. But yeah, it was pretty consistently, I wasn't working, I wasn't able to do anything, so it was about all I could do to drive here.
Mm-hmm.
So it wasn't that hard to make the decision to do it.
Yeah.
And now I'd say I probably come every other week on average.
Well, so how long have you been doing Feldenkrais for?
Probably about 1.5 years.
Okay.
Yeah. What's been really fascinating through this whole process is that, you think it's one thing. So we're like, okay, I have this inflammation in this area, and okay, boom, that's what it is. We're going to go focus on fixing that. And I think as most, for lack of a better phrase, alternative therapy practitioners are aware, nothing is really that kind of isolated.
Yeah.
There's always a bigger picture to everything.
Yeah.
So we started finding things like, we were doing some movement one time, and I had this total flashback to when I was like 4, and I had bad scoliosis as a kid, and I used to have to do these exercises for the doctor of pelvic tilting, where I would like lay on my back and have to squish my mom's hand between my lower back and the floor, and I had this insane flashback about this. And all of a sudden that generated all this stuff, and we noticed that I've been, since pretty much then, overcorrecting my posture, which was like another thing that we then could work on fixing. And so then it's, slowly all of these little pieces fall into play. And the strangest example I've realized in the last few months is, this is going to sound, well, personal, but odd. But if you ever go have like a really legit bra fitting, one of the things they'll tell you is that the band has to be even all the way around. Like, it's not supposed to go up in the back, right? It's supposed to be totally parallel all the way around. I've never had that. Like, I've always had my bra straps on the shortest strap, and it just sort of, that's how things fit right on me.
Yeah.
And that's not the case anymore at all. So like my whole posture of the way my back and shoulders are has completely shifted.
Oh, wow.
So things just fit differently. It's very, like my mother, of course, because moms, right, know you better than almost anyone else. My mother just noticed, I'd say in a few months of my coming Feldenkrais, once I was able to be up and about and walking, a few more months after that, she started noticing, she's like, your posture's different. I didn't even ask. She's just like, you're walking differently.
Yeah.
It's very interesting.
Yeah, that's such a huge shift.
Yeah. In a relatively, so I'm 30, like, a year of my life is a pretty short period of time comparatively.
So do you feel like that this has affected a lot of aspects of your life?
Everything.
Everything.
I do everything differently. I'm just more aware of my posture now. So if something hurts or feels off, I'm looking more at myself and maybe how I'm functioning. That might shift that. So like I was very particular about my office chair, or if I'm at the gym on the elliptical machine and I'll start going, and my knee, I have a bad knee. My knee will start getting a little achy. The first thing I look at, rather than being like, crap, my knee hurts, okay, I have to stop. The first thing I look at is like, okay, maybe I'm leaning too far forward. Maybe my posture's off. Maybe I just need to move a little differently. And so it started affecting all of that, which is really interesting. But it also just, I think, keeps me from doing other things that can make stuff worse. So like, I lift weights now, or I used to, and I had stopped for a long period of time, and I'm back doing that again. And I'm much more aware if I'm doing an exercise where normally my head might be like this, keeping things in line. And I think it keeps me from getting hurt more or less. I get hurt less. But I think it also probably allows everything else to do what it's actually supposed to do as compared to affecting things that you may not naturally want it to.
I get this sense that you can do things that you used to be able to do, but also that maybe you can, like, you learned from this thing.
Absolutely.
Like, and yeah. So.
There's things I can do now that I couldn't do before. So I mean, the biggest gift obviously is I have my life back. So everything I could do before I can do now, which for a long period of time, I mean, if I didn't take a pain pill when I got up, I couldn't get out of bed. I mean, that was, and then I would get out of bed, and I had a chunk of probably about 2 years where I really couldn't do anything with my hands out in front of me. Couldn't read a book. Couldn't, if I didn't have an electric toothbrush, which I can use lying down, I probably wouldn't have been able to brush my teeth. I couldn't cook. Like literally couldn't cook. Couldn't do my laundry. I mean, I was 100% dependent, which in your late 20s, when you've been independent for a chunk of years, is pretty crappy. So I mean, I have all that back, which is amazing. But the other interesting thing, so because I had a bad knee, I've never really been able to wear heels comfortably. And I now can, in certain, obviously, not a stiletto heel, not something really high. My knee, the anatomy of my knee, which is bad, did not suddenly just get better. I mean, it's not a miracle worker. But I can do things because my balance is better and my posture is better. I can do that, like walk in a pair of heels. Or I used to not be able to walk barefoot, like without my shoes and my orthotics on, for any period of time without pain. I don't wear shoes around the house anymore at all. So I mean, that's totally new and adjusted. I think if I hadn't had this, I don't think I would be, I think I'd still be in bed and on pain meds. Probably indefinitely, is my theory. Because the cycle just makes itself worse over time.
Have you noticed a change in your creativity or expression?
I have. The big thing I noticed is that when my pain got bad, and I don't know if it was the pain or the meds I was on for the pain, but I'm a painter. My ability to be creative just stopped. I mean, my natural state, like I'll walk around and I'll see the lighting hit someone and I see a painting in my head. Like that's my natural level of functioning. And that completely stopped. And that's all come back. I should say, I couldn't used to sit like this in a chair. Like I could, like just historically, I've never had great posture. I used to not be able to like sit cross-legged because I had no support for my back. I needed to be able to lean back against something, and I don't need to do that anymore. Cool. Which was kind of cool.
I'm not there yet.
It just kind of happened. I noticed it one day.
Your story is just really inspiring.
Oh, good. I'm glad. I mean, I figure if something good can come out of all of it, I mean, obviously something good's come out of it for me. I don't know if I would say if I could go back, I would do it all over again. But I certainly don't feel like now I've wasted 4 years of my life, which I think a year ago I would have said I wasted 3 years of my life. So that's a cool plus. But I don't know. I think the way most people it seems like when they go through something pretty traumatizing and can come out of it, if they can use that to help anyone else, it's always really good.